Hello and welcome learners of Dr. B.R. Ambedkar Open University. Today we are going to consider an important lesson that is called data collection methods. This is part of the Unit 13 and being offered in the first year of MBA HHCM program. And the block is Sampling and Research Methodology. Let's get started. How accurate you think the hospital statistics are? Well, you may think they are accurate, but I'll give you a different imagination. Let's imagine a hospital wants to know the incidence of diabetes in a city, and the survey they conducted is only about a few patients, and that too from a small ward. Do you think that sample represents the whole population of the city? Well, not. That's exactly what we are going to look at it. So data collection is an important method to see or enable the accuracy of the data, reliability of the data, as well as the representative results. So I'm sure that you got some sense of data collection by now. So what are the learning objectives of this session? We are going to learn, there are 4 objectives. The first one being understand various methods of data collection. The second one being learn the merits and demerits of each method that we are going to discuss today. The third objective is to apply methods in healthcare and hospital research. That's where the bulk of data collection going to take place. The fourth and the last objective of this session is to look at and interpret data correctly using right examples and also the charts. Okay, so what do you mean by data collection? Data collection is the process of gathering, collecting information systematically for research, and also we will be able to use that for analysis, and then the same analysis can be used for decision making for the future. So it serves 3 purposes. First and the foremost thing is for the research, the second one is for analysis, and based on those analysis we will be able to have lots of decision making techniques. Well, many of you might even think, why is it so important? So data collection is important for various reasons. A few reasons are listed here. Let's explore each one of them. First and the foremost reason why data collection is important, because it ensures accurate research results. So your accuracy of the research largely and fairly depends on the type of data that you have collected. If you have collected spurious data, then you may get spurious results. So your results are dependent on the quality of the data. Hence, it's all the more important to have it. The second one is that you will be in a position to make lots of healthcare policies. Most of the policies and practices in the government, especially in the public health, is decided by the data collection. The quality of the data will enable to make the government healthcare policies quite accurate. The third one being to allocate the resources. Whatever may be the size of the organization or the hospital or the government, the scarcity of the resources are always fundamental, and that is why you have to help through the data collection the allocation of the resources. The fourth reason why data collection is important is that it's going to support evidence-based medicine. It is not just by chance, it is not by quackery. It is largely by evidence-based research. Evidence-based research would help you to get the quality of the medicine. You can have a finest treatment as far as possible in curing the patients. So these are the 4 reasons that you have come across why the data collection is important. Now you may get this thought that what kinds and types of data exist? Well, there are 2 important things. First and the foremost you may have heard of is called the quantitative data. Quantitative, as the name suggests, is a numerical data where you have numbers. Example, you're going to get numbers for blood pressure. So what is your blood pressure? And heart rate, your heartbeat is also in numbers. This is how you're going to get the quantitative data. The second one, which is opposite of the quantitative data, is the qualitative data. So what is a qualitative data? Qualitative data are categorical data, or you may even call it descriptive data. For example, you have patient's feedback. Patient feedback can be qualitative in nature, and you may also get a lot of patient symptoms. When you record the symptoms, it's a qualitative data, because this would also differ from one patient to the other patient, right? So you can even have, on the basis of the types of data, two important data types like primary data and secondary data. So what is the primary data? Primary data is nothing but you are collecting the data directly from the source. And what about the secondary data? Secondary data are the published sources. That means you are taking care of the existing records. So you can download them, you can analyze them, and you can make interpretations and decisions. So these are the two different types of data that you can see it. There is also the data collection form. It includes 10 steps. Each one is following a hierarchical progression. As you can see from the graph, right from step 1 to step 10, if you followed, then there is every possibility that you will be in a position to have a scientific data collection method. Let me just give you an overview of the data collection methods. What are there? There are umpteen number of data collection methods. A few of them are listed, and we will go one after the other. But first, check the list. The list includes surveys, or also called as questionnaires. You must have heard of surveys and questionnaires. The second one being interviews. A lot of interviews are conducted through the experts, through specialists, all of that. The third one being observation. Observation can be direct and can also be indirect. And the fourth one happens to be experimentation or experiments. The fifth and the last one could be existing records or the secondary data. We will explore each one of them in our subsequent slides, right? So let's begin with the first type of data collection method, that is surveys and questionnaires. The word surveys and questionnaire would give you an idea that you are going to collect the data through structured tools. Like you will have lots of questions listed on a piece of paper. It could be printed, and it can also be taken on the printout paper, or it can also be circulated through Google Forms, and hence it can also be called as online questionnaire. So both are possible. If you take a printout, you will have the paper, or if you do it online, if you send the link like you often get through the Google form, that is through the online form. So what are the things that you're going to capture using the surveys and the questionnaires? Largely in the hospitals, you will have patient satisfaction levels. So you are going to conduct a survey across hospitals to find out how patients are perceiving the satisfaction in the hospitals. That's one form of it. I hope that you have understood it. Let us also look at the advantages of it. There are lots of advantages for the surveys or questionnaires. First and the foremost advantage that you will get is that you can collect the data from many people quickly. At one go, you will get plenty of them. Imagine you have 200 email IDs of the people and you are sending an online form. So at one go, you will be able to get them. And if all the 200 people have replied and given responses, you will get the data. So it is quickly, and it's also going to get to large masses. That's the first advantage. The second one being the standardized questions allow easy analysis. So if you have followed the step-by-step structured way of looking at the questions in a logical manner, then it would be helpful for your analysis. So your analysis are also dependent on the quality of the questions, isn't it? And the last and the foremost, which is quite crucial, is the anonymity. Since the questionnaires are not being named, you don't have to mention your name, and this anonymous questionnaires can actually give you a lot of honest feedback. Honesty can come through anonymity, right? But there are few limitations to the questionnaires and the surveys. What are they? The limitations are like the risk of incomplete or false answers. If the questioner did not respond to all the questions or left 2 or 3 questions just like that, so it is going to give you a false response or sometimes incomplete responses. The second one being the requires literacy. It's very important that you are going to have the questionnaires or surveys largely on the basis of the literacy. If somebody doesn't know how to read and write, you may not be able to obtain the right responses. In fact, they would not be in a position to even attempt. The third limitation is that you have to or may not capture the detailed feelings. Since the questions in the questionnaire or in the survey form, they are not really being designed to capture the feelings, and that is why this is another limitation. I'll give you one example as far as the hospital is concerned. A survey asking patients about the waiting time. So you're going to ask a bunch of questions. A couple of questions I have listed here, like how long did you wait to get the appointment of the doctor? So the patient comes and it takes a lot of time, and maybe 1 minute, 5 minutes, 30 minutes. With that question, you are in a position to reduce the time of the patient and also increase the efficiency and effectiveness in the hospital. Let us look at other question. The second question could be asked while you're conducting a survey is rate your satisfaction level from 1 to 5 scale. So the patients can give the satisfaction from 1 to 5. That is why it's important to look into it. So this is the graph which actually tells you the waiting period, the satisfaction, all of that in one go. You can even have the pictorial and also the visuals so easily. The second method of data collection is the interviews. Interviews are nothing but oral questioning of the individuals. You can ask many questions to the patients, to the experts, and you can even get it from others. So all the participants, you will be in a position to have oral responses. It can be done face to face, but it can also be done through online as well. With the advent of the technology, a lot of interviews are also being done using online tools. So what are the different kinds of interviews that you usually come across? There are 3 different types, or structure wise you can say 3 of them are there. First and the foremost thing is structured. You have listed down the questions in a logical flow, that is why it's called the structured interview. The second one being semi-structured, as the name suggests, based on the responses of the respondents or the participants, the questioner or the interviewer might be in a position to ask questions. So there is no hard and fast rule that you are going to follow the same structured format. It's a semi-structured interview. The third one being unstructured, totally allowing the participants to be asked questions which can actually going to capture a lot of finer details which may not be possible through the structured or semi-structured interviews. Each one of them have their own advantages and disadvantages, but structured is predefined questions. Whereas, take an example. So you intake the interview for a few patients and same questions are being asked to multiple patients together. That's the beauty of the structured questions. Whereas semi-structured, as I told you, They have the predefined questions, but in addition to that, there is also flexibility or follow-up based on the responses of the individuals who are participating in the interview. The third variety of the interviews is the unstructured interviews. What happens in the unstructured interviews? You have open-ended questions. You have lots of flexibility to ask questions. And like, for example, you have patients' experience with chronic illnesses. You're trying to understand the feelings of the patient. You will also like to know about the medicines that the patient has taken. What medicines have done to the patient while he is undergoing the treatment. All these things can be formed as part of the unstructured interviews. It has its own bunch of advantages and disadvantages. Let us look at a few of the advantages. What are there? The first and the foremost advantage that you generally come across is the in-depth information, which may not have been perhaps possible to capture through surveys or questionnaires. So interviews gives you a lot of in-depth information. The second one being the clarification possible. Because it's face-to-face and you will have a better feedback mechanism. You can seek a clarity with the interviewer and the interviewee. They are facing each other, so anything, any doubt, any ambiguity can be easily clarified using the interviews. The third one being, it can also capture, which was not possible in the surveys and questionnaires, about the feelings and the experiences of the participants. So these are the bunch of advantages that you have. So like any method is not foolproof, it has its own limitations. So as the data collection as far as interviews are concerned. So one of the limitations of interviews is time consuming. You need to have lot of ample time to conduct interviews. The second one being, you require the skill of the interviewer to extract right and finest variety of information. So if you're not well trained, the interviewer may not be in a position to extract the finer details. And the last and the foremost thing is the possible interviewer bias. If the interviewer advertently or inadvertently in a position to get biases, there will be an issue with the interviews. So these are the limitations you have. We'll now quickly move on to our third important method. It's called observation method. As the name suggests, observation. Data is collected by watching or recording the behaviors. So if you are a manager working on the hospital floor and you would like to know what are your staff doing, you may have installed the CCTV cameras and you know by just looking at the cameras where the staff is and what are they doing. And it's a rich source of data collection. For example, observing hand hygiene practices among hospital staff. After they touch the patient, it could be a dental clinic, it could be any other clinic. Usually in the dental clinic, if you remember that the doctors would go and wash their hands. Although they may be wearing clothes, they may be wearing masks, all the hygiene practices can be observed, and based on that you can give feedback to the staff. Where do they lack? Why do they lack? And if needed, training can also be provided to them. What are the different types of observations that you may come across? First and the foremost thing is the participant. Participant basically are the ones who can also join the observation. So the participant and the observers are part of the activity. The second one is non-participant. Non-participant where the observer doesn't really interact. You may be passive and looking into the camera or looking through the window about the behaviors of the hospital staff. The third one being the structured types. You can have a checklist and through which you can easily understand what are the different levels of the behaviors that you're observing. It's quite structured in nature. The fourth one being the unstructured part. You are allowed to take a lot of free notes. You can even make a lot of ideas, suggestions, feedback, anything. That happens only in the unstructured observation. Now let's pay attention to the advantages as far as the observation method is concerned. There are quite a few advantages. First being direct data collection. Like in interviews, you will have the direct data collection. You may be observing the behavior of the patient or the staff, but you get the data directly. And the second one being it captures the real behavior. So you know when the participants, the patient and the staff, whether they have hand washed or not. So it's kind of a real behavior. The third one being useful when self-report is unreliable. When you give it to the patients or to the staff, generally there is a tendency, if you ask them questions, they might exaggerate about self. But with observation method, you can reduce this self-reporting bias. So that's why this method is quite useful. Even this method has its own limitations. What are these limitations? The first and the foremost limitation that you generally come across is the observer bias. The observer himself or herself can also show lots of biasness, and that is why it's one limitation. The second being time consuming. In order to observe the behaviors of the participants, you have to allocate lots of time. Imagine if you want to understand 8-hour shift of a hospital staff, then you have to go through the CCTV of that staff member for about at least 6 to 8 hours, which is really time consuming. The third one being behavior might change due to observation. If the participants come to know that you are observing them, it would be very difficult for them to, maintain the same decorum. They might try to alter their behavior. So there is a possibility of changing the behavior. We now move to the fourth and important method called the experimental method. Experimental method basically allows the researchers to manipulate their variables. These variables would also going to affect the impact and the outcome of the study. That's why experimental methods are being conducted at various places and stages in the hospital research. So, for example, testing new drug effect on the blood sugar levels, you are trying to control few of the variables. So what are the different types of experiment that you will be in a position to conduct? There are three. The first and the foremost is the laboratory experiments. You will have laboratories to conduct these experiments. The second one is the field experiment. Perhaps you have to go to the field to collect the data, and it may not be done sitting in the laboratory. This is totally going outside the laboratory. Sometimes in the field, you may have to visit a rural place to understand why children are suffering with diarrhea, all of that. And the last one, the third one in the experiments is the clinical trials. N number of clinical trials are being done, especially for vaccination. You may have come across that lots of clinical trials were done for COVID-19 vaccination, and that's where you'll be able to know about it. Like other sets of data collection methods, even experiments have lots of advantages and disadvantages. Let us look at few of the advantages. The first advantage is the cause and effect relationship. So being a researcher, you will be able to establish the causality, how one thing causes the other, how X causes the Y, how one variable impacts the other variable. So in experimentation, you will have a lot of causality. The second one being the control environment. So researchers would also like to control the environment so that the other variables are not impacted the focus and the study of the variables. In most of the cases, this is very crucial and important. The last one is the repeatability. Anybody, any researcher, not here but anywhere else, would be in a position to repeat these experiments and get the same outcome. And that is why it's more evidence-based research. Evidence-based research are largely done through experiments. Similarly, it also has lots of limitations. Let us look at what are the limitations that we are going to look at it. The first limitation is expensive and time consuming. So to conduct an experiment, you need to have laboratory, or in order to go to the field, you need to have a lot of funding, and it's also time consuming. Let us say you want to conduct the rural villages in Telangana, and do you have the funding? Do you have the time? Because in order to go and collect the data from the field might require months together. So time and money both are important, right? The second one being ethical consideration. How do you ensure that you are not collecting the data through the dubious means, or the researcher biases are not creeped in, and hence ethics will actually fall into it. So the third and the last limitation as far as the experiments are conducted is may not reflect the real world setting. If you are doing it in the laboratory, which may have nothing to do with the real world, and you may be absent from the real world scenario and setting. So it's important that these settings are also going to reflect the real world. We now move on from these types of data collection methods to other one, which is secondary data sources. As we generate lots of data, and hence it's important to look into it. Let us look at that. So using previous collected data, we may be in a position to look at the new insights like the hospital records, published sources, and research articles, government reports. These are all the examples of the secondary data collection. Example, hospital admission records to study trends in influenza. In the last 5 years, what are the different trends that you have seen? Let us say 2020 to 2025. What has actually happened in every year as far as influenza is concerned? So if you look at the reports, so these are the published reports through which you are going to make a lot of inferences. What are the different types and advantages of secondary data? One, it is cost effective because you don't have to go to the source to collect the data. These are all published sources. All you have to do is to seek permission or subscribe to the databases and you can download it. That's why it's cost effective. Second one being it's readily available. Availability, accessibility is not at all a problem. The third one being historical analysis is possible. What happened when in 1916 a similar virus has attacked? So you can compare COVID-19 2020 virus with the 1916 viruses that have spread across the world. So historically you can establish few things. There are few limitations for the secondary data sources. The first limitation is it may not fit the research purpose. Your data may not come along with the objective of the research. So there is every possibility your data is going in some direction and your research objective is going in another direction. And there is every possibility that the data might even become obsolete or outdated. So that data you may not be able to use it for your research purpose. The third one being data quality issues might even crop up. The variables that you are trying to study may not be listed there, or there are numerous variables that are there which may not be of greater importance to your study. So you can even do a lot of comparison. You can even get mixed methods through all these methods. And which one you're going to choose? It comes through your research objective and the type of data that you want to use it, and it also depends on the time and money and the resources that are available to you. And you must always consider ethical consideration, because as a researcher you would like to know different ethical standards. So patient survey usually done through interviews. You can see lots of advantages through that, and hand hygiene compliance can be done through observation method, and you can even comply with the WHO standards. What do they do generally? So if you get sneezing, how do hospital staffs actually going to take care of the sneezing? Are they going to do it on their hands, or are they just going to move to their shoulder, somewhere near the shoulders? So likewise, you also have the drug effectiveness largely conducted through the means and so on. So sampling plays an important role in the data collection, and based on the sampling method you are also going to take care of it. So few of the tips before we wrap up is that you should have a clear and understandable simple language as far as you design your data collection tools, and you have to avoid the leading question. You should not be putting the words into the mouth of the participants, because you're trying to get it through ethical ways, all the data collection, right? And the third one being include closed and open-ended questions so that you get the depth of your data collection. You should also be in a position to ensure the quality, and that's why you need to train the data collectors, and you can do lots of pilot testing, and you need to have supervision, and then of course you have to gain accuracy and completeness, and that comes through data entry, data cleaning, and analyzing the data, and also the usual presentation like the tables, graphs, charts, and so on. The last part is the ethics in the data collection. You should take the consent of the participants. You should maintain the confidentiality of the records. You should not be able to send it or sell it to others, and then as far as possible minimizing the harm, and do avoid the common mistakes of collecting the wrong data and poorly designed questionnaires and so on. So I think we are in a better position to understand the whole data collection methods. Let's quickly wrap up. And data collection is key for research accuracy, and there are various multiple methods available based on the purpose of the research you're going to employ them, whether you're going to employ questionnaires, interviews, experiments, or observation. This is what we have also learned in detail about their advantages. And the last one, the selection depends on the objective, resources, and ethics. There are few references I believe that you should be able to pay attention to for further reading. With that, we come to the end of this wonderful session on data collection methods. Hope you liked it. We will see you with yet another scintillating edition of the Dr. B.R. Ambedkar Open University lesson. Until then, it's goodbye from all of us.